Hey, Paul, this is Howard again. If you don't mind, I got one more question, but I also want to know that's really interesting information that you have those alternative locations. I hadn't heard that before. This is a little more of a policy question, I guess, but I wanted to get your thoughts if we could. There's been a lot of chatter this week about reopening the economy. The president came out with his 3-point plan. He and Cuomo have kind of gone back and forth. Genesee County, it seems like we've had a higher prevalence of cases than a lot of other rural counties, and 6 yesterday, 5 more today. What, if you had a chance to advise the governor specifically how to approach the situation in Genesee County, what would you say about, you know, opening up society, opening up the economy again? Are we ready for that yet, or how far away do you think we are? If you have any thoughts.
Well, I guess I would offer, number one, that, we're looking at things from a public health perspective. I'm not an elected official. I'm not one of the ones that's in charge of making those decisions. And I do believe that we need to make sure whatever we do is done out of a thoughtful process where we're, really taking health and safety at the first and foremost front end of things. The last thing we want to do is, get in a situation where we, roll things out too quickly and we open things up and we get in a situation where we now have a second spike or a second wave in a rush of new cases. I think it's very important, number one, that we have lab capacity testing on the front end for positives and then also antibody testing on the back end for those that may have already had COVID-19. We need to understand the picture of what's going on in our communities. And to this date, as we've talked about many times, unfortunately, we don't. This is not an issue just in Genesee and Orleans County, but also throughout Western New York, Central New York, and around the country in different areas. So until we, have a full understanding of what's going on, I think it's very challenging to make decisions around opening things up. But again, I do believe that just like in the country, there's different, levels of activity in different states. The same thing is here in New York State. We're not all the same. We have bigger urban areas. We have a lot more activity downstate than we may have upstate in Western New York. So I think there needs to be good conversations around what's appropriate where and when and how we do that. And I think it's going to take, again, open, candid conversations and to do it safely and to do it in a way that, again, we can get things up and running and back to some sense of normalcy, but making sure that we're protecting folks as best we can as we do it.